Final warning: 13 critical symptoms of pancreatic cancer you can't ignore. Pancreatic cancer is one of the deadliest because its symptoms seem harmless and are often overlooked. It acts silently, disguising itself as common problems, and by the time it's noticed, it's often too advanced. But your body always gives signs. The difference lies in who decides to listen. Its symptoms may seem disconnected, but they could all be telling you the same thing. Something is very wrong inside you. In this video, you'll discover the 13 most critical symptoms of pancreatic cancer. Signs often ignored or treated as trivial, but together they could save your life if identified in time. Watch this video to the end. What you'll discover here could change how you view the little signs in your everyday life. Number 13. Jaundice. Imagine looking in the mirror and noticing that your eyes and skin are turning yellow. This symptom, known as jaundice, is one of the most obvious signs that something serious might be happening with your liver or pancreas. In pancreatic cancer, jaundice usually occurs when a tumor blocks the bile duct. This prevents bilirubin, a yellow pigment produced by the liver, from being properly eliminated. As a result, it accumulates in the body and changes the color of the skin and eyes. This blockage of the bile duct is not just an anatomical detail. It's one of the first indications that the pancreas may be compromised by a tumor. When bilirubin can't find a way out of the body, its accumulation becomes toxic, causing symptoms that go beyond skin coloration. Many people also report a general feeling of malaise, which can be mistaken for tiredness or a mild flu. It is precisely because of this subtlety that jaundice should be taken seriously and investigated urgently. The progression of jaundice is usually silent. It starts discreetly, with a yellowish hue only in the eyes, which often goes unnoticed. Over time, the yellow color spreads to the face, neck, and eventually the entire body. In more severe cases, the skin can take on a bronze coloration. This gradual evolution can deceive the patient, leading them to delay seeking a diagnosis. However, the earlier the cause is identified, the greater the chances of effective treatment. A complicating factor is that many people associate jaundice only with liver issues. This creates a false sense of security, especially when liver tests show no significant changes. What few know is that the pancreas, by pressing on the bile ducts, can cause the same symptoms. Therefore, it is crucial to consider pancreatic cancer as a possible cause when investigating unexplained jaundice, particularly in people over 50. Another worrying point is that jaundice often appears when the tumor has already reached a more advanced stage. In many cases, it is the first visible symptom of a disease that has been developing for months in silence. Pancreatic cancer is known precisely for its discreet and dangerous evolution. The presence of jaundice should serve as a red alert, especially when there is no history of liver diseases or other apparent explanations. Number 12. Dark urine. Have you ever noticed your urine darker than usual, with a color similar to black tea or cola? This can be an early but serious sign that something is not functioning correctly within your body. In the context of pancreatic cancer, this symptom is directly related to the buildup of bilirubin in the body. Before the skin or eyes become yellow, the excess of this substance can manifest in the urine. It's a silent but urgent warning that the body gives. Bilirubin, normally excreted by the liver in bile, begins to accumulate when the bile duct is blocked, and this blockage can be caused by a tumor in the pancreas. The dark urine appears because the kidneys try to compensate, filtering out the excess of this substance from the body. Although it's a defense mechanism, it reveals that bile is not being processed as it should. Thus, a sign many ignore can be the beginning of a serious condition. Unfortunately, because this symptom can have other less serious causes, such as dehydration, urinary infections, or the consumption of certain medications, is not always given the proper attention. However, the multiplicity of possible causes makes it essential to consult a professional. In the case of pancreatic cancer, time is a critical factor. The earlier the investigation is carried out, the greater the chances of an early diagnosis and successful treatment. Another important characteristic is that, unlike jaundice, dark urine can appear isolated and anticipated. This means it can be one of the first warning signs. Often, the patient notices this change in the bathroom, but does not associate with something more serious. Therefore, it is important to learn to observe the signs your body emits, no matter how subtle they may seem. Health is in the details. In addition to the coloration, the urine may show changes in odor and frequency. Some people report a stronger, almost acidic smell and a burning sensation. Others notice that they are urinating less, even though they are drinking the same amount of water. These symptoms, when combined with dark coloration, warrant immediate investigation, especially if they appear along with other signs that will still be revealed in this video. Number 11. Pale or greasy stools. Have you ever noticed the color of your stools when you go to the bathroom? As strange as it may seem, this detail is a powerful indicator of what's happening inside your body. Pale, whitish, or greasy-looking stools are clear signs that digestion is not occurring correctly. In the case of pancreatic cancer, this usually indicates that the pancreatic or bile ducts are blocked. This prevents the release of enzymes and bile, which are essential for the digestion of fats. This type of stool, often sticky and hard to flush, is called steatorrhea. It occurs when fats are not absorbed by the intestines and are instead eliminated directly in the stools. This is common in situations where the pancreas cannot release its digestive enzymes, and this failure can be the result of a tumor blocking the passage of these substances. With this, digestion is compromised and the body begins to lose essential nutrients. Besides a different appearance, the stools can also have a very strong and unpleasant odor, almost unbearable. This happens because the decomposing fat ferments in the intestine. It's a sign that something serious is underway. Unfortunately, many people just change their diet or use medications on their own without seeking a diagnosis. This delays the recognition of the real problem, a possible pancreatic cancer that grows silently. Another point to observe is the frequency of this symptom. If you notice abnormal stools just once, it could be the effect of a specific food. However, if this pattern repeats for days or weeks, it needs to be investigated urgently, especially if the symptom is accompanied by weight loss, abdominal pain, or jaundice. Repetition is a sign of chronicity, which suggests something deeper and more worrying. The digestion of fats depends directly on bile and pancreatic enzymes. If they are not released properly, the body suffers from poor absorption of fat-soluble vitamins such as A, D, E, and K. This can lead to serious nutritional deficiencies over time. The damage goes far beyond the intestine. It affects bones, skin, immunity, and even the nervous system. Therefore, pale or greasy stools should be treated as an important alert. Did you know that the pancreas has a vital role in digestion? Without it, the body cannot break down and absorb food efficiently. When a tumor compromises this function, signs appear, and the stools are one of them. It's time to abandon embarrassment and face reality. Looking at what comes out of your body is an act of care, responsibility, and above all, prevention. Number 10. Loss of appetite. Loss of appetite is a silent but worrying symptom, especially when it arises suddenly and persistently. It's not just an emotional or psychological consequence. It's a direct effect of the physical and metabolic impact that the tumor exerts on the body. It's as if the body loses interest in food because it's fighting something bigger. This symptom is related both to the physical obstruction of the digestive tract and to changes in the production of hormones and inflammatory substances by the tumor. The pancreas itself, when affected, interferes with appetite by altering the metabolism of nutrients and glucose. The result is a dangerous cycle. You eat less, have less energy, and the body becomes even more vulnerable. Weakness sets in and compromises simple daily activities. The problem is that loss of appetite is easily overlooked. Who hasn't gone through a phase of stress, sadness, or even poor digestion that affected hunger? For this reason, many people don't realize they are facing something more serious. However, when this symptom lasts more than a week or comes with other signs like weight loss, nausea, or abnormal stools, the warning light should immediately turn on. One of the most worrying features is that in pancreatic cancer, loss of appetite often occurs before other more evident symptoms. The patient simply starts to refuse food without being able to explain exactly why. This can happen even in people who have historically always had a good appetite. This sudden change should be investigated thoroughly. Eating is a vital act. When the body loses interest in food, it signals a deep disturbance. Pancreatic cancer, by interfering with digestion and hormone regulation, disrupts the entire system that controls hunger and satiety. In addition, the inflammatory processes associated with the tumor alter the neurotransmitters related to appetite, such as ghrelin and leptin. This deregulates the system in a complex way. The consequence of this loss of appetite goes beyond weight loss. It also compromises the body's ability to respond to its own treatment. Patients who are poorly nourished have more difficulty enduring chemotherapy, surgeries, and other procedures. Therefore, at the slightest sign of rejection of food, especially without an apparent emotional cause, it is ideal to seek medical help. Number 9. rapid and unexplained weight loss. Sudden weight loss might seem like a gift to many, but when it occurs involuntarily, it should be seen as an alert. In cases of pancreatic cancer, this rapid thinning is one of the most common symptoms and, unfortunately, one of the most overlooked. The body begins to disappear without the person having made any effort for this to happen. And behind this loss of mass, there's a profound imbalance. The pancreas plays an essential role in the digestion, especially of fats. When a tumor interferes with the release of pancreatic enzymes, the food is not properly processed. This means that, even though you're eating normally, the body can't absorb the nutrients. The energy that should be extracted from the food is wasted. The result is continuous weight loss and muscle mass loss, even with an apparently sufficient diet. Moreover, cancer alters metabolism in general. The body enters a state of chronic inflammation, and this accelerates the degradation of tissues, including muscles. The body, trying to fight the tumor, consumes more energy than usual. It's as if it were in constant war, draining reserves to remain functional. This state of hypermetabolism causes extreme tiredness and weight loss, even with adequate caloric intake. Another crucial factor is the anorexia associated with cancer. This has nothing to do with classic eating disorders, but with the involuntary loss of the desire to eat. It's common for the patient to lose appetite and, at the same time, feel that foods taste different or unpleasant. This food aversion, combined with poor nutrient absorption, forms a devastating cycle. The body enters a nutritional collapse, and the person loses weight non-stop. The impact of this loss goes beyond aesthetics or weight on the scale. With muscle loss comes weakness, a drop in immunity, and a risk of infectious complications. The body becomes more vulnerable to any external aggression, including the therapies intended to combat the cancer. Many patients are forced to interrupt aggressive treatments because they are too weak to endure them. Therefore, controlling weight and diet is vital during the diagnosis. Number 8. Nausea and vomiting. Occasional nausea may be something routine, associated with bad food or temporary indisposition. But when nausea and vomiting become frequent, intense, or persistent, it's time to sound the alarm. In pancreatic cancer, these symptoms are common and occur for several reasons. One of the main ones is the compression of digestive organs by the tumor's growth. When the pancreas presses on the stomach or duodenum, the transit of food is affected. This physical obstruction causes a buildup of undigested food, generating discomfort, a feeling of a full stomach, and often vomiting. The patient feels nauseous when eating, and this further affects their appetite and weight. In some cases, even small amounts of food cause intense reactions. This directly affects nutrition and quality of life. Eating, which should be a pleasurable act, becomes a daily torture. Another factor contributing to nausea is the altered production of digestive enzymes. The pancreas, when compromised, fails to release the substances necessary to break down food. This makes digestion slow, ineffective, and uncomfortable. Foods ferment in the stomach, causing gas, reflux, and retching. The patient may feel constantly nauseated, even on an empty stomach, leading to weight loss and social isolation. Besides the physical factor, there's also the chemical aspect. Cancer releases inflammatory substances that interfere with the functioning of the gastrointestinal nervous system. This alters the vomiting control center in the brain. As a result, the patient experiences persistent nausea, even without a visible cause. This sensation is often exacerbated by smells, movements, and even the mere thought of food. It's a debilitating symptom that needs attention. Number 7. Upper abdominal pain that radiates to the back. Imagine a persistent pain in the upper abdomen, which starts as a mild discomfort and becomes constant, eventually radiating to the back. This type of pain is one of the classic symptoms of pancreatic cancer, especially when the tumor affects the back part of the organ. The location of the pancreas, deeply lodged in the abdomen and close to the spinal column, explains this sensation that travels from the stomach to the back. It's a pain that doesn't easily subside and tends to worsen over time. This pain often intensifies after meals or when lying down. Many patients report that the discomfort is more severe at night, disrupting sleep and causing insomnia. The reason is that the weight of the food in the stomach and the body's position press even more on the tumor. This creates an exhausting cycle. The person feels pain, avoids eating, loses weight, weakens, and the tumor continues to grow silently. Another important aspect is that this pain can be mistaken for muscular issues, hernias, reflux, or even gastritis attacks. This similarity of symptoms complicates early diagnosis. Therefore, many people spend months treating the pain inadequately with palliative medications without realizing they have a tumor progressing. And this delay is precisely what makes pancreatic cancer so dangerous. This pain can be dull or sharp, but it's almost always continuous. In some cases, it is accompanied by a sensation of heaviness or pressure in the abdomen. Others describe it as a knife in the back, coming and going without warning. Any abdominal pain that persists for more than 2 weeks should be investigated, especially if accompanied by other signs like weight loss, jaundice, or changes in stool. The local inflammation caused by the tumor can also affect the nerves in the area. This explains the radiation of the pain to the lower back area. When nerves are involved, pain management becomes more complex. Common analgesics don't solve it, and specialized care is necessary. This directly impacts quality of life, as constant pain interferes with all daily activities. Upper abdominal pain is one of those treacherous symptoms that people tend to ignore. It grows in intensity, but because it's gradual, many get used to it. They only seek help when the pain becomes incapacitating. And at that moment, the tumor may already be at an advanced stage. Pain is the body screaming for help. And screaming, in this case, is a favor it does. Number 6. Sudden diabetes or worsening of pre-existing diabetes. Few people associate the pancreas with diabetes, but the link between these two conditions is profound. The pancreas is responsible for producing insulin, a hormone essential for controlling blood sugar. When a tumor affects this organ, it can drastically interfere with the production and release of insulin. This explains why the sudden onset of type 2 diabetes, especially in people without a family history, can be a warning sign for pancreatic cancer. And even more alarming is when pre-existing diabetes worsens quickly and inexplicably. Many people find out they have diabetes in routine exams, but do not relate this to something more serious. However, a new diagnosis of diabetes in adults over 50, especially with weight loss and appetite, should be cautiously investigated. The tumoral pancreas may no longer be functioning properly, subtly, but progressively compromising insulin release. The result is a lack of blood sugar control, even with an adequate diet and medications. This is more common than imagined in patients with hidden pancreatic cancer. In addition, the tumor can cause insulin resistance through the release of inflammatory substances. That is, even if there is still hormone production, the body begins to respond inefficiently to it. This causes blood sugar levels to spike, leading to a diagnosis of diabetes without clear causes. This is a deceitful characteristic of the disease, as it masks the real symptoms behind a seemingly common diagnosis. In cases where the patient has had diabetes for years, pancreatic cancer can cause blood sugar levels to suddenly become uncontrollable. Even with the proper use of insulin or other medications, the sugar level starts to fluctuate a lot. It's a sign that the pancreas may be under attack, functioning less and less. This sudden worsening is another point that requires urgent medical investigation. It's not just a treatment failure, but the possible presence of a tumor. This connection between pancreatic cancer and diabetes is still rarely discussed in the medical office. Many professionals do not consider the hypothesis right away, especially if there is no pain or jaundice. But it's precisely the absence of traditional symptoms that makes the combination so dangerous. When diabetes appears out of nowhere or worsens without explanation, a pancreatic imaging exam should be a mandatory part of the investigation. Ignoring this symptom can be a serious mistake. The relationship between pancreatic cancer and diabetes is so established that some studies suggest new diabetes as a possible marker for hidden pancreatic tumors. Patients over 50 who develop diabetes suddenly should receive close monitoring. Many lives can be saved if this sign is interpreted with due attention and speed. Number 5. Persistent fever with no apparent cause. Having a fever is common in various situations, from flu to simple infections. But when the fever persists for several days without a clear reason, it's a sign that the body is facing something more serious. In the context of pancreatic cancer, the fever can arise for two main reasons: secondary infection or inflammation caused by the tumor itself. In either case, it's an alert that should not be overlooked. The body is in a state of war, and the elevated temperature is the siren. In some cases, the tumor blocks the bile ducts, creating a favorable environment for the proliferation of bacteria. This can lead to internal infections such as cholangitis, which cause high fevers, chills, and night sweats. The patient feels constantly feverish, even with the use of antipyretics. The fever may come and go, but always returns, indicating that the infectious focus is still active. This type of fever, associated with abdominal pain or jaundice, should be treated as a medical emergency. But even without infection, pancreatic cancer can cause fever. This occurs because the tumor releases inflammatory substances, like cytokines, that affect the body's internal thermostat. It's usually a low but persistent fever. It can last weeks, causing fatigue, loss of appetite, and a constant feeling of malaise. This inflammatory fever is a sign that the body is trying to fight something that shouldn't be there, the tumor. It's important to remember that fever by itself is not a diagnosis, but a symptom. What differentiates common fever from that associated with pancreatic cancer is the duration and the lack of a clear explanation. When all known infectious causes are ruled out and the fever continues, it's crucial to expand the investigation. Unfortunately, in many cases, initial exams do not include abdominal images, delaying the diagnosis of the tumor. Another point is that this persistent fever can be underestimated by the patient. After all, it's usually not very high, and it's often attributed to the heat of the day or a passing flu-like state. But the repetition of this symptom, especially when associated with other signs such as extreme tiredness, abdominal pain, and weight loss, forms a worrying overall picture. It's the combination of small signs that builds a revealing clinical picture. Health professionals also need to be vigilant. When a patient reports ongoing fever without classic signs of infection, it's necessary to think outside the box. Number 4. Abdominal bloating and gas. Feeling your abdomen bloated occasionally might seem normal, especially after a heavy meal. But when abdominal distension becomes frequent, persistent, and uncomfortable, it's a symptom that needs attention. In pancreatic cancer, this bloating is often linked to poor digestion, obstruction of the digestive tract, or fluid accumulation in the abdominal cavity. The feeling of always being full is more than uncomfortable, it's a silent alert. The tumor can interfere with gastric emptying, causing what is called gastroparesis, a slowness in digestion. With this, food remains in the stomach longer, ferments, and produces gases. The patient feels bloated, as if they had eaten too much, even after a small meal. This digestive sluggishness is a direct reflection of the functional impairment caused by cancer. Moreover, the pancreas, by failing to produce digestive enzymes, compromises the proper breakdown of food. This causes food remnants to pass into the intestine without being fully digested, causing fermentation and excessive gas production. The result is constant abdominal discomfort, often accompanied by intestinal noises and flatulence. The distension can be so intense that it interferes with sleep and daily activities. Another contributing factor is the accumulation of fluid in the abdominal cavity, called ascites. Although more common in advanced stages, ascites can appear early in some patients with pancreatic cancer. It creates a visible swelling and a sense of internal pressure. Often, the patient reports difficulty breathing or moving due to the accumulated volume. It's a severe manifestation that requires immediate medical evaluation. Distension may also be accompanied by pain, cramps, and changes in bowel rhythm. In some cases, there is an alternation between diarrhea and constipation, further confusing the diagnosis. This irregularity reflects the disorganization of the digestive process and the systemic impact of the tumor. The compromised gastrointestinal system begins to send confusing and uncomfortable signals. Unfortunately, because it is a common symptom in various benign conditions, many people ignore this bloating or try to resolve it with teas and home remedies. But if it persists for days or weeks, especially in association with loss of appetite, nausea, or altered stools, it's time to investigate thoroughly. Number 3. Constant fatigue. Feeling tired occasionally is normal, especially after busy days or sleepless nights. But when this sensation of exhaustion becomes part of the routine, even without major physical efforts, attention is needed. Constant fatigue is one of the most common and, at the same time, most underestimated symptoms of pancreatic cancer. It arises insidiously like a weight that doesn't pass, a tiredness that not even rest resolves. And this type of fatigue is not psychological, it has physical, metabolic, and organic roots. This persistent exhaustion occurs because the body, trying to fight the tumor, enters a continuous inflammatory state. This process consumes energy and resources, even if you don't notice it. Additionally, pancreatic cancer compromises nutrient absorption, which means that, even with eating, the body is not being properly nourished. Without nutrients, there's no fuel for the cells, and the result is intense fatigue, difficult to describe in words. Another point is the psychological impact of the disease, even before the diagnosis. The person feels different, notices that something is wrong, but doesn't understand what. This sensation generates anxiety, insomnia, loss of motivation, and more fatigue. The body and mind are in conflict. Vitality disappears. Often, this fatigue is mistakenly attributed to stress, depression, or sedentariness, when in fact it is a sign that there is something much deeper going on. The production of red blood cells can also be affected. In some cases, pancreatic cancer leads to a condition of anemia, which further intensifies the feeling of weakness and sleepiness. The person may wake up already exhausted, have difficulty performing simple tasks, and live in a constant state of energy deficiency. This anemia is multifactorial, caused by poor nutrient absorption, loss of appetite, and inflammatory effects of the tumor. Beyond physical weakness, fatigue in pancreatic cancer affects the emotional and social side. The patient begins to isolate themselves, avoids commitments, reduces contact with friends and family. Activities that were once enjoyable are now avoided due to sheer lack of energy. This withdrawal is not laziness or lack of interest, it's a direct reflection of how much the body is internally fighting against something serious. This symptom, although subtle, has enormous diagnostic value when combined with other signs. Intense fatigue, associated with weight loss, digestive changes, and abdominal pains, forms a worrying clinical picture. Chronic fatigue cannot be ignored, especially if it arises without a clear reason and worsens over time. Your body is signaling, is asking for help. It's up to you to listen. Number 2. Intense itching on the skin. Skin itching seems simple. It can be caused by allergies, insect bites, or even a hot bath. But when this itch is intense, diffuse, and does not improve with lotions or antihistamines, something more serious may be happening. In the case of pancreatic cancer, itching is often linked to the accumulation of bilirubin in the blood, the same pigment that causes jaundice. When the bile ducts are obstructed by the tumor, this substance spreads throughout the body and reaches the skin. This excess bilirubin stimulates nerve endings, causing an itch difficult to relieve. The most striking thing is that this itching can precede the visible appearance of jaundice. That is, even if the eyes and skin are not yet yellow, the itching may already be manifesting. And what seems like a common dermatological problem may, in fact, be an early sign of biliary obstruction and pancreatic cancer. The itching usually affects mainly the palms of the hands and soles of the feet, but can spread throughout the body. It's an uncomfortable sensation, often desperate, that disrupts sleep and peace of the patient. There are no visible lesions, which makes diagnosis even more difficult. The skin is marked by the patient's own nails from scratching so much, but there are no rashes, spots, or external signs. This distances the hypothesis of dermatological causes. Another important point is that this itch usually does not respond well to conventional treatments. Moisturizing creams, anti-allergics, and cold baths do not offer lasting relief. And it's precisely this resistance that should raise suspicions. The problem's origin is not in the skin, but in the liver and pancreas, which are not properly processing bile. The symptom is external, but the root is internal and serious. This itching may be accompanied by other signs such as dark urine, pale stools, and loss of appetite. When these symptoms combine, it is essential to investigate hepatic and pancreatic function. A simple blood test can reveal elevated levels of bilirubin. From there, imaging tests can identify if there is a blockage in the biliary system. And in many cases, the hidden villain is the pancreatic tumor. Unfortunately, many people deal with this itching for months before getting the correct diagnosis. They visit dermatologists, take allergy medications, change their diet, all in vain. The problem persists, wears down the quality of life, and delays the recognition of the true cause. This is another example of how pancreatic cancer hides behind common symptoms, waiting for just a chance to advance. Number 1. Mental confusion in advanced stages. In the more advanced stages of pancreatic cancer, a symptom that can arise and cause great concern is mental confusion. The patient begins to exhibit frequent forgetfulness, difficulty concentrating, mood changes, and even delusions. This condition is called encephalopathy and originates from a metabolic dysfunction caused by the disease's advancement. The liver and kidneys, overwhelmed by toxins, fail to filter the blood properly. The brain then begins to feel the effects of this silent intoxication. This confusion is not like the memory loss associated with age. It is something more acute, sudden, and noticeable. The person gets lost in conversations, forgets important facts, has difficulty recognizing familiar faces. In more severe cases, they may present hallucinations or intense agitation. It's a sign that the body is entering collapse. The mind, which has always been alert, now seems clouded, disconnected from the world around it. The accumulation of bilirubin in the blood is one of the main culprits for this condition. When the liver can no longer process this substance, it accumulates and affects the central nervous system. In addition, the nutritional deficiencies, dehydration, and electrolyte imbalance common in the final stages of the disease worsen the situation. It's a cruel cycle. The body weakens, and the brain suffers the consequences. Another relevant factor is the use of strong pain control medications. Opioid analgesics, frequently used in patients with advanced pancreatic cancer, can cause drowsiness, confusion, and even delirium. Although necessary to relieve physical suffering, these drugs have important side effects, especially in already weakened organisms. The result is a clouded, disconnected, and fragile mind. The family, witnessing these changes, often does not understand what is happening. The patient begins to act differently, says nonsensical things, forgets who they are, or where they are. This transformation is painful to witness and requires emotional support for everyone involved. It is at this time that palliative care takes on a central role, seeking comfort, dignity, and serenity for the patient. It is important to understand that mental confusion is not just a neurological symptom, but a reflection of the overall suffering of the organism. The brain, extremely sensitive, is one of the first to react when internal balance breaks down. Recognizing this sign is essential to providing the appropriate support, whether medical, psychological, or spiritual. The focus at this stage should be to relieve suffering and ensure quality of life until the end. If you are accompanying someone who has begun to exhibit mental confusion, abrupt changes in behavior, or unusual forgetfulness, seek medical help immediately. And if you want to keep receiving the best videos for your health, subscribe to the channel because it exists for one reason: to make you a healthier person with a better quality of life. Helping you is my mission. In the video that now appears on your screen, I reveal the 3 worst fruits that harm and cause numbness in your feet. Click on the screen and check it out. So until the next video.